The COVID deception. What is really going on? If you believe all that you're told about COVID-19, you need to think critically about the facts. You need to read between the lines. You've only got to look at the numbers. Reported on the same day on UK TV news, but in separate reports, and the numbers have been rounded, we were told, 1, there had been 65,000 excess deaths year to date at the time of the reports, and 2, 40,000 people had died with, but not of, COVID-19. It follows by logical deduction that 25,000 people had died because the NHS was on virtual shutdown to elective surgery, or that people had been scared into not seeking help when they felt ill and therefore subsequently died. It was also reported that of the 40,000 people who had died with, but not of, COVID-19, 85% were 70 years old or older with underlying health conditions. Of the remaining 15%, that's 6,000 people, it was reported that the vast majority had one or more underlying health issues. We're told that the vast majority of people with COVID-19 display either no symptoms or mild symptoms, with only the minority suffering significant symptoms and a minority of that minority needing hospital treatment. Data on the website centreforcities.org as of 14th September 2020 listed the number of cases per 100,000 people in various UK cities. As of that date, the most affected city was Blackburn with 105 cases per 100,000 people. To put that into perspective, if that data were represented on a bar graph, with one bar representing 100,000 people and the other bar representing 105 people, that's the 105 cases. Using a scale of 1mm to represent one person, the bar representing the cases of people with COVID-19 will be 10.5 centimetres high. The bar representing 100,000 people would be 100 metres high. To visualise that scale, 100 metres is 1.5 times the height of Grenfell Tower, a building which sadly many of us are now familiar with. So to put those figures into the context of a valid graph of presentation on TV news teams would have to find a very tall building upon which to draw their graph. The way COVID-19 deaths are reported adds further confusion. Note that figures are reported as people who have died with, but not of, COVID-19. Initially, if somebody who had been diagnosed as having COVID-19 had died at any time after their diagnosis, they were counted as a COVID-19 death. Those figures were later revised down so that only those who died within 28 days of being diagnosed as having COVID-19 were included as having died with, but not of, COVID-19. So if an individual who was diagnosed as having COVID-19 were run over by a bus on the way home from that diagnosis, their death will be counted as a COVID-19 death. There are anecdotal reports that hospitals and care homes are being pressed to record cause of death on death certificates as being COVID-19, with stories in the sums in the order of £25,000 being paid for each such record. This analysis makes reference to the UK, but similar situations subsist throughout the developed world. This analysis does nothing more than ask the question, what is really going on? We were led to believe that hundreds of thousands of UK citizens would die as a result of this so-called pandemic, yet the number of deaths is in the thousands. Of course, it's impossible to know how many people actually died of COVID-19 as the statistics are muddied. For many people, COVID-19 is so mild they don't even know they've had it. Contrast that with the draconian actions taken by the UK government and other governments to deal with this. What for the overwhelming majority is a very mild illness, and it is clear to see that there is a huge disconnect between the two, between the illness and the actions taken to combat that illness. Our government's actions have decimated the UK economy, and yet the situation is not lives v money, but it's lives v lies. We have already mentioned that earlier this year there had been reports of 25,000 excess deaths due to the virtual shutdown of the NHS. We are now told that the hospital waiting lists in the UK are at an all-time high, which undoubtedly will lead to further untimely deaths. The author of this analysis does not believe for 1 second that there is a pandemic, or at least that the pandemic is what we are told it is. So the question remains, what is really going on?